A dangerous condition. Friends, let's talk about a serious condition called thyroid storm. Maybe you've heard about hyperthyroidism, where your thyroid gland is overactive. Imagine that thyroid storm is its most severe version. It's a sudden and extremely dangerous surge of thyroid hormones in our body. This is not just anything. It's considered a medical emergency because if not treated immediately, it can lead to severe complications and even be life-threatening. The body is like a machine that suddenly runs too fast and too hot, beyond its control. The danger of thyroid storm lies in how it disrupts the normal function of our entire body. Too much thyroid hormones speed up all processes inside us. Metabolism speeds up tremendously, as if you're running a marathon even when you're just lying down. Because of this, vital organs like the heart, brain, and liver are forced to work overtime. This sudden stress on the body can lead to the failure of these organs. That's why it's so important for us to know its symptoms so we can seek medical help immediately. It's important to clarify that thyroid storm is not a common illness. It's rare, but when it happens, immediate attention in the hospital is needed. People with hyperthyroidism or Graves' disease that is not properly treated are most at risk. They have high levels of thyroid hormones that can suddenly spike due to a trigger. So if you have hyperthyroidism, it's very important to follow your doctor's advice and take your medications regularly to avoid this dangerous situation. Understanding the severity of thyroid storm is the first step to protect ourselves and our loved ones. This is a situation where every minute counts. Rapid recognition of symptoms and bringing the patient to the emergency room can save a life. The body cannot withstand this kind of stress for a long time. Taking care of our thyroid health should not be ignored, because a small gland in our neck has a big effect on our overall health. Let's not take it for granted. Thyroid storm doesn't just appear without a reason. Usually, it happens to people who already have hyperthyroidism, especially if it's uncontrolled or untreated. Imagine that their body already has high levels of thyroid hormones. All it needs is a trigger or a spark to ignite the condition. The most common trigger is suddenly stopping medication for hyperthyroidism. If you have maintenance medication, never stop it without consulting your doctor. This is very dangerous. Another big trigger is having a severe infection in the body, such as pneumonia or sepsis. The stress caused by the infection can lead to a sudden release of too many thyroid hormones. This also includes other types of severe stress on the body, such as surgery, trauma from an accident, and even childbirth. Even severe emotional stress can trigger it in some cases. So it's important that if you have hyperthyroidism and are undergoing surgery, your doctor should know about it so they can take steps to prevent thyroid storm. Some medical procedures can also cause it. For example, the use of contrast dye with iodine for CT scans can trigger thyroid storm in people with pre-existing thyroid problems. Iodine is used by the thyroid gland to make hormones, so a sudden increase in it can worsen the situation. Even excessive squeezing or palpation of a large goiter or lump in the neck can cause the release of many hormones. This is why examining the neck of a patient with a goiter should be done slowly and carefully. There are also medications that can be triggers. Some medications, like amiodarone for the heart, have high iodine content. Even excessive intake of thyroid hormone medication, whether intentional or not, can lead to thyroid storm. Knowing these possible triggers is very important for patients with hyperthyroidism. By avoiding them and communicating with your doctor, you can greatly help keep your condition under control and prevent this deadly complication. Thyroid storm is like a strong typhoon raging through the entire body, affecting almost every organ system. The heart is one of the first and most dangerously affected. Excessive thyroid hormones cause the heart to beat too fast and too strong, which is called tachycardia. The heart rate can reach 140 beats per minute or more. Because of this, the heart is forced to pump blood without rest, which can lead to irregular heartbeats like atrial fibrillation, or worse, heart failure or a heart attack. The brain or central nervous system is also severely affected. The patient may experience extreme anxiety, irritability, and restlessness. They may become very nervous and anxious. As the condition worsens, it can lead to more severe symptoms, such as delirium, where the patient is confused and cannot think clearly. They may also experience psychosis, where they see or hear things that aren't there. In the worst cases, it can cause seizures or coma, which is a clear sign that the brain is in extreme danger. The body's temperature control system also goes out of balance. One of the most well-known symptoms of thyroid storm is a very high fever, which can reach 40 to 41 degrees Celsius. This is not an ordinary fever caused by infection, but rather due to an excessively fast metabolism that creates too much heat in the body. This is accompanied by intense sweating as the body tries to cool itself down. This high fever, if not controlled, can cause damage to the body's cells, especially in the brain. The gastrointestinal system, including the liver, is also not spared. The patient may experience vomiting, diarrhea, and abdominal pain. The liver can swell and be damaged due to excessive stress, resulting in yellowing of the skin and eyes or jaundice. The muscles are also affected, causing weakness and tremors. Even the lungs can be affected, causing difficulty breathing due to weakness of the respiratory muscles or due to fluid accumulating in the lungs due to heart failure. Clearly, thyroid storm is a multi-organ disaster. To make it easier for us to remember, let's list the symptoms by organ system. In the heart and circulation, the most obvious symptom is an abnormally fast heart rate or palpitations. The patient may feel like their chest is pounding hard. They may also experience chest tightness, as if something is pressing down. Blood pressure may initially rise, but can dangerously drop as the heart weakens. Hands and feet may swell due to fluid retention caused by possible heart failure. When it comes to the brain and nervous system, symptoms often begin with changes in behavior. The patient may become extremely agitated, anxious, and restless. They may easily get angry or irritated. Over time, they may become confused or disoriented, not knowing where they are or what the date is. Tremors in the hands are also very common. In severe cases, this can lead to loss of consciousness or coma. So if you have a family member with hyperthyroidism who suddenly becomes confused or anxious, take them to the hospital immediately. For body temperature, the cardinal sign is a very high fever. This is a fever that does not go down even with ordinary medications like paracetamol. The patient's skin is usually hot and clammy due to intense sweating. Due to this sweating and possible diarrhea, they can easily become dehydrated, which will further worsen their condition. Redness of the skin may also be noticed. The combination of high fever and rapid heart rate is a dangerous sign that requires immediate attention. In the stomach, liver, and lungs, symptoms may occur together. Nausea and vomiting are common, along with frequent diarrhea. This contributes to dehydration. There may also be pain in the upper right abdomen, which is a sign of liver problems. If the liver is already affected, the eyes and skin will turn yellow, or jaundice. Meanwhile, breathing may become rapid and shallow or shortness of breath. This can be due to weakness of the respiratory muscles, or due to fluid in the lungs, or pulmonary edema, if the heart is starting to fail. A common question I'm often asked is whether having a thyroid nodule or lump in the thyroid immediately means you're at risk for thyroid storm. The simple answer is no. Just having a thyroid nodule does not automatically mean you are at risk for thyroid storm. Many people have thyroid nodules that are benign or non-cancerous, and their thyroid function remains normal. These nodules are called non-functioning because they don't produce too many thyroid hormones. The risk for thyroid storm comes from hyperthyroidism, particularly from what are called toxic or hot nodules. These are thyroid lumps that are overactive and produce their own thyroid hormones without control from the body. When you have this type of nodule or toxic adenoma or many such nodules or toxic multinodular goiter, that's when your risk increases. These conditions cause hyperthyroidism, and uncontrolled hyperthyroidism is the root of thyroid storm. So the key is to find out if your nodule is hot or cold through a test called a thyroid scan. That's why regular checkups with a doctor are very important, especially if you feel a lump in your neck, or if you have symptoms of hyperthyroidism like tremors, sweating, weight loss, and a fast heart rate. Your doctor will tell you what tests are needed, such as blood tests, TSH, FT4, and a thyroid ultrasound to determine your condition. If it's proven that you have hyperthyroidism, you will be given the right treatment to control your hormone levels and prevent complications. As a final reminder, let's not panic if we have a thyroid nodule, but let's not ignore it either. Proper care begins with proper knowledge and regular checkups. Thyroid storm is a serious condition, but it can be avoided. Following your doctor's advice, taking your medication regularly if needed, and knowing the symptoms to watch out for are your best protection. Let's take care of our health, especially our thyroid. Remember, prevention is always better than cure. God bless you all.